Prediabetes patients with sleep apnea improve glucose with continuous positive airway pressure. I'm Erin White, and this is the Daily Rx Minute. Prediabetes is a condition defined as higher than normal blood glucose levels, but not high enough to be considered diabetes. Using continuous positive airway pressure for sleep apnea may help reduce blood sugar levels. The therapy requires the delivery of mild air pressure through a mask or other device to keep the body's airways open. Ask your doctor how sleep apnea treatment can benefit you. For dailyRxTV, I'm Erin White.